Welcome. This training provides a clinical overview of icon resin infiltration and the recommended protocol for treating superficial white spot enamel lesions. Additional protocols are available for deeper lesions and advanced applications. This module will focus on foundational technique and predictable outcomes. ICON represents a revolutionary microinvasive approach to managing enamel white spot lesions and opacities. Using a low viscosity resin, the infiltrant penetrates the porous enamel structure, replacing air and water within the lesion. This changes the way light reflects through the enamel, effectively masking the lesion and blending it with surrounding healthy tooth structure. The result is immediate aesthetic improvement, without drilling, without anesthesia, and typically within a single patient visit. The ICON patient pack includes three key components: ICON Etch, 15% hydrochloric acid; ICON Dry, 99% ethanol; ICON Infiltrant, a low viscosity resin. The pack also contains 5 smooth surface application tips. Each component plays a critical role in achieving optimal infiltration and aesthetic results. Before developing an appropriate treatment plan, use transillumination to assess the lesion depth and determine whether it is suitable for resin infiltration. Transilluminating at each step is a useful resource that helps guide your treatment protocol along the way. In many cases, bleaching may be recommended by the clinician or requested by the patient. Allow a minimum of 2 weeks post-bleaching before treatment. This ensures enamel rehydration and reduces the risk of sensitivity interfering with results. For this example, we'll review the ICON resin infiltration treatment steps for a superficial white spot lesion located close to the enamel surface. Clean the affected tooth and adjacent teeth, then remove any cleaning with water spray. Then apply a rubber dam or liquid rubber dam. A key component of successful treatment is to maintain a dry working field. Once isolated, abrade the lesion with plain pumice using a fine grit disc to remove residue and assess the lesion body by opening the pore structure. Avoid fluoride-containing cleaning agents prior to treatment. They can reduce etching effectiveness. If you're treating post-orthodontic white spot lesions, ensure orthodontic cement residue is removed prior to infiltration. It can block the infiltration process. Apply ICON Etch directly to the lesion and let it remain for 2 minutes. For deeper lesions, etching about 2 millimeters beyond the lesion will provide more suitable access. This step uses 15% hydrochloric acid, not 27% phosphoric acid, so follow all manufacturer instructions carefully. After 2 minutes, suction off the ICON Etch, rinse with water for 30 seconds, and dry with oil-free, water-free air. Next, apply ICON Dry to the tooth for 30 seconds. Dry the lesion with oil-free, water-free air. This step provides a visual preview of the final result. Assess the color change, and if the lesion remains visible, you can repeat the etching and drying steps up to 2 more times for a total of 3 etching and drying cycles. It's important to avoid over-etching, which may damage the enamel structure. If results remain unsatisfactory after 3 cycles, further evaluation is recommended. As with any dental procedure, taking photographs is helpful at each step. Once the spots have visibly diminished, we can move to an infiltration step. Apply the ICON infiltrant directly to the lesion for a minimum of 3 minutes. Research has shown that a long infiltration time can positively impact the aesthetic outcome. For deeper lesions, extending the exposure time is recommended. Remove excess material and light cure all sides for 40 seconds. Ensure the infiltrant is fully cured. Checking your curing light regularly is helpful. Using a new tip, reapply the ICON infiltrant for 1 minute and remove any excess material. Then, light cure all sides again for 40 seconds each. Rinse thoroughly, remove the rubber dam, and use polishing cups for the surface finish. A library of clinical cases and studies are widely available on the subject of resin infiltration with Icon for dental professionals across North America, and product information is available online at drilling-no-thanks.info or on DMG America's website at dmg-america.com. Start changing lives and transforming smiles without the need for drilling.